I mean, it's a mobile clinic, it's a truck on wheels. It's not your standard doctor's office.
The Medical Outreach Clinic's been in existence for about 25 years. It's sponsored by McLaren Macomb Hospital and also through grants and funds through the state and through philanthropic organizations like Blue Cross. We drive the Medical Outreach Clinic truck into areas of Macomb County 2 days a week and treat patients at no cost to them. We do exams, we write prescriptions, we order tests, we do x-rays, everything at no expense to the patient. He is legendary. Dr. McClellan is fondly referred to as kind of the godfather of family medicine at our hospital. The Medical Outreach Clinic was kind of his baby. He was the one that came up with the idea. He was the one that pitched it to the hospital originally 25 years ago and got them to understand the need for it. His enthusiasm for medicine is unbelievable. I've never met any physician who has as much passion, as much dedication for medicine and the people of the community as Dr. McClellan.
It was always designed to be a teaching clinic. It is essentially an opportunity for one-on-one faculty to student teaching. It is a somewhat unique aspect of medical teaching afforded by the space limitation. It's fairly easy to eavesdrop on the student's interaction with patients. If it's not top quality care, we can remediate it right then and there. So it's a somewhat unique, very intense medical education opportunity.
You get, the different variety of students. It brings a different level of teamwork to patient care because you're not only working with a doctor, but I'm a pharmacy student, you have medical residents, occasionally we have a different PT student, and they just bring a different level of something you wouldn't get in a doctor's office on a daily basis.
We usually have 1 or 2 third and fourth year medical students. We have 1 family practice resident. We train pharmacy students from Wayne State University. There's often 1 or more of them. We have trained guidance counselors, social workers, physical therapists, occupational therapists, speech therapists, speech pathologists, dietitians. There have been a fair number of people rotate through our facility. We've had a relationship with Wayne State in terms of student nurses as well. We've trained a fair number of them. First and foremost, students, I think, appreciate the philanthropic effort of the hospital. Several members of the hospital leadership team get it, and they have been willing to support us. I think the students learn to recognize the limitations that poverty places on patients. I think the students learn to recognize that a thorough history, a thorough physical exam, and appropriate studies are the only way that we can exist.
I get to see a lot of different styles of patients. They all have different medical problems, different medical histories. It's something I don't get in school because in our patient care lab, all we experience is, the standard scenarios, and they're always the same, they're always repeated. So with this clinic, you kind of get a wide variety of patients and styles, so you learn how to treat different disease states, treat different emotions because you deal with the emotional state of the patient every time you see them, and you kind of get to know them, and it kind of becomes familiar, and you get the continuity of care when they come back every couple of weeks.
Probably the biggest thing that they learn from the clinic that they really can't learn anywhere else is a true sense of empathy for the patients. Our patients are, at the Medical Outreach Clinic, they're in a tough situation. They don't have any insurance, most of them are low income, some of them are completely homeless, and it humbles the students a little bit. It helps them get back to the roots of why they wanted to go into medicine, to help people. It takes them away from some of the more jaded aspects of medicine, the bureaucratic stuff, the political stuff, the insurance stuff. All that stuff goes out the window at the Medical Outreach Clinic. We just take care of people the best that we can do, and I think that's an experience that's unique and incredibly educational for medical students.
You learn the hands-on method of being a physician. You learn that every time you walk in the door, a patient is going to have different issues that they're concerned about. Whether or not it seems complicated to you because of the textbook, it's a real concern, and you start to learn the empathy and the compassion and learn the ability to treat each individual thing as a physician, but also as a person and as a human. You start to understand what the true challenges are. Not being able to make a copay of $5 and not being able to get the medicine that you need because of lack of insurance. You learn to do more things with your hands instead of relying on lab reports or EKGs or things that you try to avoid to spend because you're trying to keep the cost down for not only the patient but also the clinic as well. I would say that it was one of the best experiences of my life. I think as a medical student, you don't get an opportunity like this before you are expected to know what you're doing as a physician. And I've already told several of my peers that if they're interested in family medicine or any primary care practice, this is a rotation that they should do, absolutely. You just don't get that kind of experience anywhere else.
A lot of times in medical school, there's so much focus on testing and board certification and achievement and knowledge, which is all important, but sometimes school unfortunately loses the humanistic side of medicine. You lose that touch aspect of putting your hands on somebody, helping them when things get difficult. The Medical Outreach Clinic provides that in a way that almost no other location can.